Statistics have shown that the southwest geopolitical zone of Nigeria has the highest number of illicit drug use. The south-south, southeast, northwest, and north-central followed respectively. The chairman of the National Drug Law Enforcement Agency, General Mohammed Buba Marwa, retired, revealed this on Monday at the flag-off of the Northwest Geopolitical Zone campaign against the use of illicit drugs organized by the National Orientation Agency held in Kaduna. The initiative was aimed at reorientating the public of the Northwest Geopolitical Zone against the scourge of drug abuse. Marwa stressed the urgent need by the government, parents, stakeholders, and all Nigerians to end the menace of illicit drug use, particularly among the youth. The 2018 National Drug Use Survey conducted by the United Nations Office on Drugs and Crime revealed an alarming reality for 14.3 million Nigerians aged 15 to 64 use psychoactive substances. I would love to get your thoughts on this. I know you're not a practicing medical professional, but I know you should be conversant with this kind of thing. I'd love to get your thoughts on this.
You know what? I really do not need to be a medical doctor to appreciate the menace of drug abuse in the society. I mean, it's one thing that has pervaded the entire country. The way youths, use drugs, abuse drugs, has become a serious call for consent. And for me, the system, the stakeholders shouldn't get tired of talking. The society shouldn't get tired of talking. The family shouldn't get tired of talking, because it has even become a normal thing where you see young kids, children in primary schools, secondary schools using drugs, and it's affecting the state of their minds. It's equally pushing them into the life of crime and criminality.
Why, if I may ask you quickly, why do you think most individuals engage in the use of illicit drugs?
You know what? It's as a result of, the decay in the moral values in the society. There is a huge deficit in moral etiquettes and conducts. Parents no longer have time to monitor their kids. You see, there's a lot of things that if these things are properly addressed in the home front, I'm sure it won't get to this level that we see it has gotten to today in the society. A very huge amount of the young ones are into drugs, and it has even become a normal thing. The way we have normalized the consumption of illicit drugs is something else. So for me, I really believe that we need to go back to the way we used to do things in the time past, where parents see parenting as a full-time job. It's not something you just live like that, because of the level and amount of exposure that the young ones have these days, especially the internet and all of that. And as we speak, more of these dangerous drugs, more are coming. Some of the ones that we've not heard of before, they are bringing new ones. So it's now left for the society, the community, to ensure that as you are shaping the society, you are shaping your child, even in the home front, that these kids are properly guided on the harms and danger of drug abuse. because it gets to a point where you become an addict, and that is the most, you know, the height of it. If you don't take it, you won't even have that you won't have that inner peace.
And then aside the parts where you've mentioned the implications, there are also health deficits involved in
exactly. That's why I said it's not, you don't even need to study medicine to begin to appreciate some of these things, because you know, of course, that if you abuse drugs, it affects your brain. It affects your sense of reasoning mentally. That is the eye. Then we don't even want to look at those internal damage that you have in some of your internal organs. But what is prevalent in the society today is we see a lot of young people who are going crazy. Just go to the streets before you walk from one pole to the other. Some of them have turned into junkies. You see them, you know, behaving in a way that is that could best be described as the way an insane person behaves, because the drug has affected that person's mental faculty. You begin to act like a mad person. The ones that are strong enough will take the life of crime, because they will need to be servicing that you know, craving for hard drugs, and these drugs are not cheap. So I want to also use this medium to say that, of course, the current DG of NDLEA is trying.
So aside calling out, aside crying out over the high rate of drug abuse in the southwest and south and other parts of the country, like he has mentioned, what do you think has to be done in order to curb? It's not be a total eradication, because it's to
of course you can't do that, because we equally have people who take these things medically. There are people who have prescription for some of these drugs. I'm talking about the tramadol, the cough syrup, and some of these you know, illicit, whatever. There are certain names they call it, but I know there are people who have the medical you know, authority to take it. They don't abuse it, so you can't even remove it completely. You know, but if I understand your question correctly, how can we reduce it to the barest minimum? And that is why the National Registration Agency, you know, in collaboration with the NDLEA, you know, should come up with a more robust strategy going to schools, secondary, primary schools. You could imagine the level of drug abuse cases in primary schools. Then secondary school, that one has gone out of hands. So the National Registration Agency, you know, should step up their game, collaborating with the NDLEA, National Drug Law Enforcement Agency, and see how they can commence a nationwide sensitization. Of course, they'll be doing it before, but they should double their effort. You know,
because the drug abuse is now on a high rate.
It's on a very high side. Youths have now become they used to say in the past that the youths are the leaders of tomorrow. But the current sets of youths that we see today are desperados. They are always under the influence of these drugs, making them to do certain things that they shouldn't do if they are in their right senses. So these are the adverse effects. And the only way that these things can be curbed, it's not enough to begin to go after crackdown, arrest, and all of that. Let us see how we can even reduce the intake. And the only way that can be achieved is constant sensitization, going to schools, primary, secondary, universities, informing, making them to understand how they should abstain from the use of drugs. Okay. You know, that can get to the hearts of some of these people, because, you know, everybody has a conscience. And if you are being told constantly that if you stop taking this thing, look, just examine yourself. If you are the type of person that take it every now and then, just stop it for like 1 month. Examine yourself and you see the difference. You will know that this thing you are taking is killing you. So let the agencies, relevant agencies, embark on sensitization. Then the home front, very important. Parents should pay a close watch on their kids. Because if your child starts taking drugs, as a parent who is observant and conversant of your children, you will know, because there are certain things that will show.
Thank you so much.